Hi everyone, welcome. Sorry I'm like about an hour late. Yeah, let's start live. So just drop your comments in the chat, and yeah, I still have an example of okay, I still have an example of question that I asked earlier before I had to leave to start work. So yeah, welcome to my live. on mute from my live. So we'll be doing the live together in terms of you'll be answering the questions and what's it called? And I'll be scoring you. So at least people can see what I do. Where's my book? Okay. People can see what I do and what I have to offer as well. I have my book, I have my pen somewhere in my bag. Okay, yeah, found it. I'm meant to be also recording interview question and answer as well. So what I need you to do for me when you do your interview, because I think there's another one of my clients that said she's going to be doing maternity as well. Or I was speaking, yeah, she probably a potential client. She was speaking to me that she's applying for maternity roles as well and all that. So she wants help with interview for the role. I think it's in Dorset as well. Is it? Yeah, but a band five. But our interview is at the end of the month, if I can remember. I'm not sure if I can see it in this chart. Yeah. She found me on YouTube Live. 30th of August. Yeah, band five and all that. Yeah. So yeah, so that's the one that she is doing. Can I help you? Did you say inside your room? Inside my room as well. Yeah. Thank you. Yeah, that's one is underneath Eden's bed too. Yes. Okay, so I need to get there. That's yours. Okay, so we're doing the prep questions for a band six maternity midwife interview for tomorrow. I have my mouse for my computer screen and I have my touch screen for this one. I'm using two computers. I'm all over the place. Okay. So let me see. Which one haven't we done? Pardon me? I'm just trying to see a question that we haven't done before. Okay, all right. Okay, we've done that one. I think we've done most of the questions actually. Let's also do CTG, with the thing CTG and perineal suturing and fetal monitoring skills. Okay. Yeah, fetal. I remember what I meant. Okay, let me try and get some questions out. So you want to focus on the CTG bits of things? Yeah, CTG, fetal monitoring. Fetal monitoring. Okay, let me do this. Logouts. So I think I already had some questions for you in that one. And perineal suturing. Hold on. I'll get some questions out now for you. Don't worry. Okay. So let me see. Let me just make sure I have the right. Okay. So you want questions? Could I please have questions on what? Perineal suturing? Yes. CTG interpretation and fetal monitoring. What's it called? And fetal monitoring skills. So fetal resuscitation. Let's put it that way. Result. Resuscitation. Resuscitation. Yeah. Okay. Okay. So the first one we would ask is, can you give me an example of when you've performed perineal suturing and how you ensured best practice? All right. Thank you very much for the question. As a midwife, performing of perineal suturing are one of the responsibilities we do. An example of when I performed a perineal suturing was when a woman was supported with an assisted delivery. She had an episiotomy done with her consent, and after the delivery, although both mother and baby were fine, it was my key responsibility as a midwife to ensure that her perineal tear has been sutured very well. With her consent, I provided dignity, ensured that she was comfortable, and then gave her anesthesia, a localized one, something like lidocaine. I waited for a little bit of time for it to absorb before the suturing process. Under a bright source of light, I assessed the type of tear, which was type 2. With their consent and involving her in her care, I used the right sutures with suturing the perineum, ensuring that it was aligned with no hemostasis. In every bit of it, I ensured that she was comfortable and keep asking if she was in pain or I needed to add up with some of the medication. She was fine with it, and at the end of the day, it was used very nicely. I documented factually and objectively, and also gave her education on how to make sure that it doesn't get infected, telling her what she should expect in case she sense that there is some foul smell, there's some leakages around the area, she should promptly come back to the hospital for it to be inspected. As a result, she came back in a couple of 6 weeks' time, and then on examination, it had healed properly and everything were done appropriately as she had wanted it. This reflection makes me understand, and it's very beautiful when you undergo certain things and they come out healing very well and fast. And as a midwife, having this skill is something I am proud to have, and I bring it on board at Dorset County NHS Foundation Trust. Okay. So you're looking up, you're not even looking at me at all. Oh my goodness. You need to look at me. That's why I said we needed to do this video um interview. So you know how you're going to present yourself. You need to look at me to ensure that you're keeping eye contact. Even if you're going to, there might be, I think there are about 2 people on the panel. Yes, two. So even if you're going to be alternating, first question you're directing your eyes at one person. Then the next question you're directing your eyes at the other person. Or even if you can direct your eyes into the middle of both of them, so you're not actively looking at them. If that might get you a bit flustered, but don't look up, look down. You need to try and keep eye contact. Okay. Okay. So I think based on this answer, which is better than what you've said previously, you talked about the situation, you talked about the task that you needed to do, you talked about the method that you're going to use, ensuring that you kept asking her about how she was feeling. You talked about your documentation. You talked about the teaching that you gave her in terms of wound care and all that. And you talked about following on from there what happened with her coming back and healing properly. So I think I have a follow-on question from that. What method of suturing did you use for her? The method of suturing was single in line, or just normal suturing, ensuring it was in close proximity. So this method of suturing is a normal perineal suturing. I don't have a name for it actually. Maybe I should look out for it. Okay. But it was a normal perineal suture. So it's a single, like from this side to that side, making sure the skin was in alignment. Yeah. Okay. I'm not. Do they have a name for it? For the suturing? Is there a name for it? If there is, I don't know. Okay, that's fine. You might need to Google it just in case there is a name for that kind of suturing, the perineal suturing. Um, so you talked about you were given some also you were using some what's it called clinical names as well. The hysterectomy you're talking about the anesthesia that you needed to use and all that. So which is very good. Um, you talked about the teaching. You talked about making sure it was. You didn't say anything about when she gets home about how she needed to take care of it in terms of the warm water and all that. So you need to add that to it in terms of part of the teaching that you were giving her. You need to also mention about all that. I'm just thinking of with being having had children. I'm just thinking of what they would have said to me, or in terms of if I had tears and all that. Um, yeah, I think with this one, I might give you a 3.54 over 5. Yeah. It's much better. If yeah, I'm sure even if you would in terms of how you're answering the questions now, you see from when we started as to and to where we're at now, it's a lot you're a lot better in terms of your structure of answering the questions. Yeah. Yeah. I'm hoping that you're seeing that as well. I'm hoping you're seeing that. Name, that's fine. If there's no name, so as long as you just explain it properly in terms of it's a single string or single line, ensuring that it's in close proximity to each other and all that, and it's nice and tight and dry. Okay, okay, okay. And you talked about the okay. Look now, Chat GPT is now telling me I use the aseptic technique. Okay. Continuous suturing method and recommended continuous suturing method. Yes. So that's the word you need to make sure you're using for that. And you talk, and even also ChatGPT was talking about hemostasis and all that, so which is fine. I'm just reading, it, even though, as in, I should have, as in, I don't need to look at it to let me know what they, as in terms of the steps are. Yeah. The woman healed well with no signs of infection. After a postnatal check, reported minimal discomfort. Expressed appreciation for my clear explanation and supportive approach. Okay, that's fine. So we're going to talk about the CTG interpretation now. Okay, so do you want to tell us about a time when CTG interpretation influenced your clinical decision making? Look at me.
recognizing of the scenario and making sure that both the mother and baby were safe. And it's an example of a woman-centered care, and it's something I'm happy to bring on board at Dorset County NHS Foundation Trust. I
Okay.
also ensure that throughout I did my documentation by writing it down factually and objectively for continuity of care and also as a legal safety and clinical expertise, even if it's needed for a debrief during an audit. Okay, so in this scenario, my fast paced thinking and what I've learned from this is my fast paced thinking, my intuitions, and also getting a second eye to come and have a look at the CTG interpretation help us to be able to save both the mother and the baby. Thank you.
Yeah. You were now adding all the right answers at the end. When you finish, you realize that I haven't answered this question properly. You are now adding it. It's fine. It's fine. No, seriously, it's fine. Like I said to you, it doesn't necessarily mean that you have to follow the star from S to R at a go. As we're writing, we would start documenting that. Oh yeah, she mentioned this. She mentioned it. I think in trying to explain yourself, you're doing the work and explaining yourselves are two different things. So
Mhm,
for us to be able to understand your thinking process, it's good for the STAR method, yes. But
mhm,
you doing it, you telling us what you would do, also shows us that you know what you're meant to do in a way. So although that
okay.
you've not said it accordingly, you've mentioned it as part of what you're meant to be doing in that scenario. We are still able to say, okay, yeah, she knows what she's meant to do. If that kind of situation occurs, she's going to be able to think on of it and be able to do the right things. It's not that because you said it at the end, that means it's after the woman has finished that you now realize that, oh, you had to be quick, you had to call people, you had to double check with other people. No, it's you saying it that shows her that you actually know what you're actually meant to be doing. So I think
Mm.
when you finish, I was like, okay, did she cross check with somebody else? Did someone else, did she request for a second opinion? I've already started writing that down as in, okay, this will be my follow-up questions for you. But you were able to recover yourself quickly and then be able to say, oh yeah, I'm doing this, I'm doing that, I'm doing that. So that's very good. Um I think I don't have any more things to say. I think I will give you like a 4 with that one. I don't tend
Okay.
to give people 5. I don't know why, but it's a very good one. I think the only comment I needed to just say in that one is the fact that you were scattered a bit in terms of the your process. So you
Okay.
need to ensure that um what's it called? You're a bit
Using
more,
this.
yes, a bit more kind
Okay.
of follow up. Even though, like I said to you, it's not compulsory that you do the star, but it's always good. Eye contact with that person you're speaking to as well is very good. So you need to continually remember that, put that back of your mind as well. Yeah.
Okay.
Um, and I like the fact that you're using all the right technical terms as well. So continue
Mhm.
using the technical terms to ensure that they let them know that you understand it and you are quite vast in the technical terminology. Even though when you're explaining to, you probably say that when I'm explaining to the patient, I ensure I'm using clear language to communicate
Mhm.
in layman's terms so that she can understand what I'm saying. Okay,
Yeah. Clear,
so that,
simple,
yeah, clear
plain
as, yeah.
language.
Okay, so that's a very good answer. I'm serious. That's a very good answer. Yeah. So for fetal resuscitation, this
Mm.
example, which are very good examples that you've been giving me. Can you describe a time you had to perform a neonatal resuscitation? What happened, and how come you had? Why did it result to you having to perform that neonatal resuscitation? What led to it?
Okay.
Yeah,
Thank you very much
and
for the
what and why
question.
you had to, and describe how you performed it.
All right. Thank you very much for the question. As a midwife, fetal resuscitation is major in our field of work. An example of when I managed a situation by resuscitating a baby was when a woman who underwent a vaginal delivery. I was the one conducting the labor. Her meconium was her glyco was heavily thick with meconium, and we knew something was wrong because we were even monitoring her on the CTG. But she had advanced on cervical dilatation, and we
Sorry,
helped her
Belinda,
with.
1 minute. Sorry. Yeah. My interview, my prep. Want me to go? Okay, I'll soon be done. I'll soon be done. So I should wait. No, no, you can go. But they're leaving the door open downstairs. Tell them to close it. Sorry. Yeah. Apologies for
All
that.
right,
So I'd like
that's all.
something
I want to
was.
start again.
Is it start again? Yeah.
Okay, thank you very much for the question. As a midwife, fetal resuscitation is one of our major responsibilities, and I'm proud I'm a trained midwife who can resuscitate babies. An example of when I resuscitated a baby was when I worked at the labor ward. I assisted the woman through an instrumental delivery, and after the delivery, the baby was very feeble, blue, and not able to cry. It was a result of a meconium stained liquor. I quickly noted the time, called for help. Whilst my other colleagues were attending to the woman, I explained to the woman briefly that the baby wasn't crying and needed much attention. I wrapped the baby up warm and cleaned her with a warm towel, take off the towel and then put a dry one towel on and ensure that I cover the baby head, only exposing the chest. Noting the time and also pressing the emergency buzzer to inform the pediatrician about the case and my other colleagues to come to my aid. By the time they had arrived, I had stimulated the baby by rubbing the back. It was my key responsibility as a midwife to ensure that the baby well-being was good. I rubbed the baby's back to stimulate her, circled the soles, baby was still not crying. I then ensured that I suctioned her nose and mouth because there was a visible obstruction using the suction machine. Baby was still not crying. I immediately used my amber bag and then used 5 inflation breaths, with each lasting about 2 to 3 seconds. So I did that, and I was still noting the time. Baby was still not crying. I was looking for the movement of the chest. So if the chest moves, that means I'm doing it correctly, and using the right size cup, fitting from the chin to the nose area. So I did the 5 inflation breath, each lasting about 2 to 3 seconds. I was looking at the up and the rise of the chest, and also inspecting if the color has changed, if there's any tone, baby looking pink, or is there's any actions on the body. Baby was still not crying. I still then did my 30 inflation breaths. So the inflation breaths, that will be 15, because I'm doing it in 30 seconds. So I'll do 15 inflation breaths. And this one, it will have to be between 1 to 2 seconds each. So I did that. And thankfully, baby, I was listening to the fetal heart rate using my stethoscope. So it was then between 110, and that was a good sign. So I didn't move on to do my chest compressions. But if the baby was still not responding and the heart rate was less than or between 60 to 100, I would have continued with my inflation breath. And then if it is less than 60 or greater than 60, I'll do my chest compressions. That will be 3:1. So 3 chest compressions plus 1 inflation breath till helps arrive. We can also give medications like glucose. We can also give medication like bicarbonate, or it's not, yeah, something like, yeah, something like bicarbonate. The medication they can give. So when the pediatrician came, that's what they gave. But in my case, after doing my 15 inflation breaths, the baby was able to cry. Heart rate was fine. The tone was fine. Alga improved from 4 to 9 in the 10th minute. So this is something I bring on board. And also throughout the procedure, I delegated a task for a junior midwife to do a factual and objective documentation of each thing we were doing for the baby. My prompt resuscitation of the baby, knowing when to escalate, I was recommended by my fellow colleagues how I was calm under pressure. The mother was glad the baby was able to come back to life, and I encouraged skin to skin and also prompted the mother and educated her to do breastfeeding, which was a very good sign. And this is one of the many skills I bring on board at Dorset County NHS Foundation Trust, and I know I'll be a valuable member of the team. Thank you.
Thank you very much for that. That seemed like a very intense day for
It's
a
very,
midwife. That seems like a lot
yes.
that would have happened that day. How long did all this take?
It took us 10 minutes.
10 minutes. So, how long did it take for the extra help to arrive?
The extra help arrived within the 10 minutes after I stimulated baby, rub baby warm, and all that.
It seemed like a lot. So, after, okay, you mentioned something, I think you were kind of contradicting yourself there in
The
terms,
medication, bicarbonate, yes, it's true.
yeah.
That's what I was just going to take. It's bicarbonate.
So, if you're going to talk about what you did, if you're going to make it look as if that happened during the shift for you, you would have to say, we did do that. It's not like
Mm-hmm.
you said if it's needed, then you now said that's what the
Pediatrician.
pediatrician did. Did you see
Yeah.
yourself? So at the back of my mind, I'm now thinking, has she really resuscitated a patient before?
Okay, so I did the resuscitation, but the medication, when they are still not responding,
Yeah.
then the
But if you
new
were
glucose
paying
follows.
attention to what was going on around you, you would have known if that medication
Oh,
was given. It's not even about the name of the medication, it's how you explained it in terms of, you look at me that you were telling me a story of that somebody told you that happened to them. It's not
oh,
you being involved in that situation. So
okay, okay.
what I'm trying to find out is if you've actually resuscitated a patient before, because the way you've explained it perfectly,
Mm-hmm.
textbook perfect and all that. But what I need to find out is, or what I would have an issue with is, because of that statement you made that towards that end of it, in terms of, if it was that situation, we would have given this. And then you
Okay,
now
so
said,
okay, let me explain this. I was telling a story that what I did after doing my inflation breast,
yeah,
the 51, the baby started crying.
yeah.
That was fun. But if so, this is a story. If baby, so I went on to explain so that they will know that I know if baby, so that the next question they will bring up. But if the baby didn't, cry or respond to the
That was what I was going to
resuscitation,
say. So what I'm
mm-hmm,
saying to you is that you said that this is what happened. In that
mm-hmm,
same light, you also then said, if the if part is, it's not about the story, it's not, you said that this is what we did. You
mm-hmm,
now said again that the no you said that what happened was this. You
mm-hmm,
now said, to make it look as if, no, that I think I'm getting confused. You said it to make it look as if you didn't need to do that, but
mm-hmm.
you then said as well that in that same scenario you needed to do that again, because the pediatrician then gave it to the baby at that time. So
Okay,
you need to
then
be,
I'll now
yeah.
construct it.
So
Yeah.
you don't try to give two stories in one place.
Oh,
So you need to just
okay,
tell me what you did
okay,
and finish it. You might not
okay.
say at the end of it, in a situation, now you might not say, as after you finish explaining, you now may now say, if in a situation where the baby had not responded like the way the baby that I dealt with responded, the
Hmm.
pediatrician would have had to then give
Oh, okay.
the bicarbonates or the
Yeah,
glucose or whatnot that they needed, the medication that they needed to
yeah,
get to give.
yeah. The
But
sodium
luckily,
bicarbonate.
when I did
Mm,
this resuscitation, we did not need
mm.
to do that. But in a
Oh, that's good.
situation where the baby did not respond in time, the
Mm-hmm.
pediatrician would then have had to give the medication.
Sure. Okay.
So,
All right.
although you're explaining it perfectly for me,
Mm,
I'm going to be a bit hesitant in terms of, I'll put a question mark on that thing, that your explanation is correct, but I'll now start thinking, has she actually done it before? It's not that you're not
okay.
a competent nurse. I know that you will be able to do it based on
Mm-hmm,
what you've explained to me, but
mm-hmm.
I need to ensure that you are able, I mean, that you are not a nurse that would lie to me. Because
Okay.
now it looks as if you are telling me a story of what you've done, but you've not actually done it. So that means
Mm-hmm.
to me you might be lying, in
Okay.
terms of, you might have all these stories of what people have explained to you of how they've performed under pressure and done all this work. But if it's
Mm-hmm.
your work that you've done, it's just like me dealing with a case of disciplinary into an allegation for someone. And I would be more confident in explaining the situation than for
Mm-hmm.
someone to what's it called, than for someone to explain a case that they're dealing with. How I would explain it to you, it's not going to be as fluent or as fluid as if I
Mm-hmm.
was the one in that situation.
Okay.
Yeah.
Okay.
Yeah.
Can I have another go to
Sorry?
just since you are, can I have another go on this question?
Yeah, yeah, yeah.
Okay, so let me have another go so I can try and just go straight to the question and not divert.
No, you answered
Okay,
the
so
question perfectly. It's not about as in the end is where the
yeah.
extra bits that you added.
Mm-hmm.
So we need to ensure that you are concise
Okay,
in your explanation.
okay. All right, so let me start with this again. Okay, thank you very much for the question.
Mm.
As a midwife, ETA resuscitation are one of the many responsibilities we do, and I'm quite happy I've been trained about it. An example of when I resuscitated a baby was when I helped the woman to deliver vaginally after a venous delivery. It was assisted because it was heavily meconium stained glycol. The baby wasn't crying. Abgar was 4 at birth and he needed resuscitation. I quickly called for help and checked the time of delivery. I dried the baby and keep baby warm under the heater. It was my key responsibility to ensure that baby was crying and the well-being was good. I then stimulated the baby by rubbing the back and flicking the sole, and then it was still no response from the baby. By checking the color, the tone, it was still no good. I then positioned the head in a neutral position and then opened the airway. I could see a little bit of obstruction, so I suctioned the mouth and the nose, and baby was still not crying. I went on to ensure that I gave 5 inflation breaths, each for 2 to 3 seconds, and I watched the chest rise, fall and rise of the chest. I then reassessed the baby. If the baby, the color was fine, the tone was normal, it wasn't. So I went on to give another inflation breath for 30 seconds. With this, it lasted for 1 to 2 seconds each. So that's 15 inflation breaths I gave. Thankfully, baby started crying. The tone was fine, color was pink, and we were able to dry baby up much again, dress baby up, and then ensured mother was able to do skin to skin. And we encouraged breastfeeding within the first hour. So we throughout everything, I also ensured that I delegated as a midwife to do a factual and objective documentation of everything that was going on. The team whom I have called had already arrived. By the time they came, they also helped support in helping the baby cry, with the color being bright, and also encouraging the mother to breastfeed the baby. In this situation, I was recommended of how calm I was, even though I was under pressure. And with the team coming up, teamwork is something I hold dearly. And one of the values of this trust is teamwork and also respect, also encouraging that we bring excellence in this. All the procedures I was doing, I was encouraging the woman using simple and plain language. What was I was doing at each step, and she was happy that I was able to step in at the right possible time to help the baby cry and have a beautiful tone. and this is something I bring on board. But in this case that the baby was still not crying and the tone wasn't good, I would continue with my inflation breath and then checking the fetal heart rate. I'm recommended that if the fetal heart rate is greater than 100 beats per minute, I'll do the observation and then support the baby. But if it was between 60 to 100, I will continue with my ventilation breath. That's my inflation breath. But if it was below 60 beats per minute, I will then add chest compressions. That is three chest compressions plus one inflation breath till baby cries, so there's much improvement, and then it can be referred to the NUCU for further treatment. So this is something I bring on board at Dorset County NHS Foundation Trust. Thank you very much.
How do you feel? You know that is a perfect answer in terms of you not just answering the question, you giving another scenario with regards to your understanding of an escalation if
Mm,
that has happened, sorry, if that is needed for an
mm.
escalation process to be put in place. So that's a five. That's that. No, seriously. Remember that question or remember that answer, how you said it now, and always remember to eye contact is very good.
Okay.
It gives person confidence and smile as they're answering the question. Be smiling. You already have a beautiful smile already. So
Oh dear.
and keep smiling. No, seriously, keep smiling about it, and that's how you're going to be able to catch them. Because if you keep smiling, keep looking at their faces, smile when you finish the answer. Ask them, are you satisfied with that? And are you satisfied with that response? Do you want me to elaborate further? You can always ask
And you
them.
said that. Okay.
You can ask them. Do you think I've answered that question properly? Do you need me to elaborate further? Do you have any further questions for me with regards to that answer I gave? Always ask
Mm,
them, so that
okay.
way, it helps you, in case you've forgotten some bits, it helps
Mm,
you, or they will probably be really nice to you and they will probably say, yeah, could you want to elaborate on this part? Because if you hadn't yet answered one part of it and they've written it down and they quickly go glance through their notes to say, okay, maybe they've noticed that, or she hasn't said this part. And you ask them, is there anything that I haven't answered? Anything you want me to elaborate further on? They'll be like, oh yeah, could you do you want to explain this part? As in most of the times we would say that, yeah, go for, as in, can you explain this part for me and all that. So we tend to do that for people that do ask. If you don't ask, you
mm,
don't get. Always
okay.
always say them. Smile, eye contact is very important. Don't look up. When you are looking up, just I need to look down. I need to look at the faces. Always have that. I know you're going to be thinking about a lot of things. There's a lot of things going on.
Mm,
Just try and make sure that, okay, I'm looking at their face. I'm keeping eye contact and all that. Okay.
okay. All right. Thank you.
What other thing do I want to? Which other one I want to ask you? Mm, okay. Okay. Another postpartum hemorrhage one.
Mhm.
Oh no, no, don't let's do that one. Let's do a shoulder dystopia. Dystopia. This,
Dystopia.
yeah. So that might come up as in that's when the shoulder kind of breaks in the birth canal, isn't it?
Trap
I'm
in
not
the breast.
a midwife, but I know this maybe because I've had children, so it kind of helps me in my understanding of what they're looking for.
Mm,
And I think because I've read the job description and all that. So yeah.
okay.
Okay. Tell
All
us
right. So
about a
what's the question?
time you manage a case of shoulder dystocia or dystocia.
Okay. Thank you very much for the question. As a midwife, management of shoulder dystocia is key, and recognizing an obstetric emergency is also important. An example of when I managed such case was when I was supporting a woman to deliver vaginally. After the head was delivered, I could see a turtle sign, which was an indication of shoulder dystocia. I immediately pressed the call buzzer and formed a multidisciplinary team, which includes the consultants, obstetrician, the pediatrician, the other colleagues, the porter, because I needed extra hand. It was my key responsibility to ensure that fetal well-being was good. In clear, simple language, I asked the woman if she still wanted to undergo vaginal delivery, and she said yes. I then explained to her that there will be a few maneuvers that have to be going on to help deliver the trap shoulder. With her consent, by the time my colleagues arrived, I delegated two of them to help me hyperextend her legs onto her chest, which is the macrobet maneuver. This helps open the pelvic diameter whilst I did gentle traction on the head to deliver the head vaginally. It was still not being delivered. So, with her consent, I scrunched my hands into her vagina, located the anterior shoulder, and then tried to rotate it into the oblique diameter. Whilst I then tried to deliver the head vaginally, it was still not being delivered. I then instructed one of my colleagues to apply a suprapubic pressure at the back of the fetal shoulder. Whilst I then tried to deliver the head vaginally, thankfully, in that situation, the shoulder was able to escape into the pelvic diameter, and through axial gentle traction, I was able to deliver the baby onto the mother's abdomen. The baby was crying, healthy baby. We quickly rubbed the baby, ensured skin to skin was done, and the rest of the delivery was continued. I was recommended of how I quickly escalated the consent and how I explained it to the woman in simple language terms, and with her consent, she agreed for us to undergo such maneuvers. But in case all these that I mentioned didn't go on well, I would have continued by performing episiotomy, means crunching my hands into the vagina and then try to rotate the posterior shoulder into the pelvic diameter and try to deliver the baby by axial traction. If it is still not good, I'll then encourage the woman to go on all fours position by helping her put her hands on the bed and her knees as well. This helps widen the pelvic diameter and hopefully I will be able to deliver. But if it's still trapped, then with her consent, she can be taken to the theater for further management, which can be savanelli or pushing back the head of the baby into the uterus, and then a cesarean section can be done or a cleredotomy can be done. So that didn't happen in my situation. In my situation, after doing the suprapubic pressure, the shoulder escaped into the pelvic diameter and I was able to deliver the baby vaginally. Noting that I've already escalated, I've already delegated a task to one of my police to do a very thorough, factual, objective documentation of every procedure and everything we did. Baby was fine, mother was okay. And these are the teamwork skills, the communication skills, the respect skills I bring on board at Dorset County NHS Foundation Trust. And I know I'll be a valuable member of the team. Thank you.
Okay, that's really good. I think I'm a bit confused when you said that the head was delivered, but the shoulder was trapped. Then later
Mm-hmm.
on, you now mentioned how you had to put deliver the head again.
Did I say deliver the head again?
Yeah.
What did I say?
You had to do gentle genital traction to
Gentle axial traction, using
bring
gentle
out the
axial
head.
traction, but maybe I said holding the head, because you
Yes.
have to hold the head.
Okay.
So using gentle axial traction, then I'll pull the head down
Oh,
and then
okay.
clip onto the mother's abdomen. So I
Okay.
will be holding the head. So maybe when I said head, it
Okay.
will be around
If-
that.
Okay.
Yeah.
So when you were doing all this,
Yeah.
was the woman not still in labor and having the urge to push?
She still had labor, so we should tell her to stop pushing. I didn't say that.
No, you did not.
Yeah.
Because I'm thinking
It's
about
very
when I'm in
important.
labor and I'm
Mm-hmm.
having that urge to push. It's very, very extremely difficult not to
Mm-hmm.
push in that
Yeah.
kind of situation. So how
Yes.
did you manage that? So that's the question. How did you
That's
manage to stop the woman from pushing while you were trying to do all this?
Okay, so with when it happens like that, even when the woman pushes, there's no effort made because the shoulders are trapped.
Okay.
So the only encouragement we give to her, because automatically we cannot prevent her from not pushing, but we would encourage her and advise her not to push because it can cause further damage to her uterus, the pelvic floor muscles, and everything.
Mm.
So with this, I would just encourage her to stop pushing because we'll be helping bring the baby out. Her effort is to bring the baby out, but unfortunately, the shoulders are trapped, so it's our key responsibility to ensure that the baby is delivered. And also, I forgot to bring this up. I would have to make sure that I take any pillows, or if her head is propped up, I make sure the bed is flat. So she has to like go her head flat, not up like that. So that's one thing I should have added onto it. Thank you very
Mm.
much.
So okay, that's maybe a 2.53 out of 5. Yeah, because yeah, it was all over the place. So do you want to give me
Mm,
another example of
yes,
of
yes, I'll
this?
go. I'll do another try.
Yeah.
Okay. Thank you very much for the question. As a midwife, management of shoulder dystocia is key. An example of when I helped solve a particular issue about shoulder dystocia was when a woman I was assisting to deliver her baby. After the head was delivered,
Mm.
the shoulders were trapped. It was my key responsibility to ensure that both mother and baby were okay. I immediately called press emergency buzzer to inform the obstetrician, the pediatrician, other midwives on the ward, the scribe, and the porters because I needed extra hands there. In simple and plain language, I explained to the woman what was happening and how I would need her consent in every stages I'll be doing. She was happy for us to help her deliver the baby. I checked her feet, the baby's fetal heart rate, which was good, fortunately for us. And then, with her consent, I ensured that I took any pillows. If her head was raised, I put it down. The time I did that, and also asked her if she wanted to undergo vaginal delivery, of which she was happy for us to help her with. My team had arrived. I delegated two of them to help me hyperextend her legs onto her chest. This is the McRoberts maneuver. This will help expand the pelvic diameter. Whilst with axial gentle traction, I tried delivering the baby. It wasn't successful, so I instructed one of my colleagues to apply suprapubic pressure at the back of the fetal's shoulder, and with that, the shoulder was able to escape through the pelvic diameter, whilst I did a gentle axial traction and delivered the baby successfully onto the mother's abdomen. Baby was crying, Abga was 8, which was good. We cleaned baby up and ensured skin to skin, and then continued with the rest of the delivery. After everything, the woman was happy that I took into a very fast intervention to help deliver the baby. But in a different scenario, whereby after we did a suprapubic pressure, the baby still hadn't been delivered, I'll then evaluate for episiotomy with the woman's consent and then scrunch my hands. If the perineum is roomy, I will not have to do any episiotomy. But if it's not, then I have to do the episiotomy. I'll scrunch my hands into the vagina, locate the anterior shoulder, and then try to rotate it into the oblique diameter, and then try to deliver the baby onto the mother's abdomen. In this situation, if it's still not good, I'll then encourage the woman to go on all fours position. This position helps increase the pelvic diameter, and by axial gentle traction, I'll help deliver the baby smoothly. But if it's still not successful at this point, with her consent, she'll have to be taken to the theater for cleidectomy to be done and other interventions to help deliver the baby. But in my situation, after the suprapubic pressure, the baby was delivered. After everything, I ensured that I did the factual and objective thorough documentation and then debriefed the woman. I did my date test and also according to my hospital guidelines, I ensured that all documentations were done clearly. And this is something I would like to bring on board at Dorset County NHS Foundation Trust, able to work as a team to bring out excellence. Some of the values of this trust is respect, excellence, and teamwork. And I know I have it all, and I'm able to help with the team and then remembering a success story like this. Thank you very much.
So much better. So much better than before. How do you feel? How do you feel about that?
I feel like, do you think I should just say what I did and try not to gossip too much and try not to add if
Extra.
it didn't come da 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 da, or
I
you
think
think
I
it's
think
good
it's
like
I
that?
think it's good for you to add that bit to it. I think it's good. But if you feel as if it's going to be too much for you to remember and to say and all that, of course, don't add it. But I think
Okay, I will remember, but I was thinking because they said if they see that you are talking too much, they will cut you short.
yes, if it's getting too longer and probably you're going to have maximum 45 minutes, 1 hour for your
Mm-hmm.
interview and all that. So yeah, if
Yeah.
they see that it's getting too long, they might want to say, okay, yeah, thank you very much for that. But they would let you finish your answer. They will
Okay.
let you finish your answer.
Okay.
Yeah.
Did I speak more than 3 minutes? Because I wasn't timing myself.
You're allowed to speak more than 3 minutes. I'll Yeah, yeah. I think you might have spoken more than 3 minutes. So you
Hmm.
shouldn't worry about that in terms of, oh, did I speak more than 3 minutes or did I speak more than 2 minutes? No, don't worry about that.
All right.
Yeah, don't worry about that. Okay. So that's a
Okay.
good answer. Should we
Yes,
do the
ma'am.
one more?
A lot more. Any other drill me.
Because I have another person coming at 7.
Yeah,
That's
that's
why.
true. If she comes, then you chop me away. Please.
I'm sure she's gonna come. And I also have to eat. I haven't eaten today.
That's true.
I'm trying to lose weight, yes, but I'm trying to lose weight, yes, but I also need to eat some food.
I know.
I also need to eat some food. Um, hold on. Okay. Oh, no, no, no.
Then tell me about yourself. Is it something they score?
Not really. Not really.
Mhm.
As in, we don't. As in, when we do it, it's just like an icebreaker. We've not even practiced that
Mm,
actually.
not really.
Yeah. Do you want to practice that?
Yeah, let me tell you what's on my
Yeah.
mind.
Tell me. Tell me.
Okay, thank you very much. And I'm happy to be here and the opportunity to be interviewed. I describe myself as a compassionate, courageous, competent, and a committed midwife with over 4 years' experience in high risk antenatal, postnatal, and also in the community and hospital. I am NIP trained, highly skilled in perineal suturing, recognizing the emergencies in obstetrics, as well as also supporting women in breastfeeding. I have a high rate of mentoring junior midwives as well. And I taught pregnancy classes in my current role as a midwife. I'm internationally trained and I'm also here in the UK as a healthcare assistant with over 2.5 years experience. Coupled with my internationally trained experience, it has shaped me to be a very valuable member of the team, resilient, able to recognize and safeguarding issues, as well as having woman-centered care at heart. Knowing UK experiences and also working under them, it has really prepared me to be a valuable member for this team because I have both experiences. And I am drawn to the County NHS Foundation Trust because of its high rate of home birth and also taking care of about 2,200 women annually. And also your CQC rating, it's good and it's a place I see myself working at. Your values,
Good.
which include respect,
Good.
inclusivity, teamwork, and excellence, is something I'm highly happy to do. And this is why I would like to work here with you. And also, I read in your website that you support midwife-led care as well as consultants-led care. And this is a community I would like to work in, which will shape me to be a valuable member. I am adaptable, ready to learn, and also flexible. I've worked a lot in the community, and knowing that I have to work in the community as well as the hospital, I think I'm the best candidate for this role. Thank you very much.
That's oh my goodness. If they don't give you a job after this, I don't know what's wrong with them. Because that is so grounded. It shows that you've read the job description. You were talking about how you fit into the job description. How I am the midwife you're looking for. That's what you've said. You need to talk about expatiate more a bit about your experience from your international experience as well.
Okay.
In terms of you are bringing in that international experience. That's your husband. You're bringing in that international experience coupled in with your learning that you have learned from your OSCE training, your healthcare system role that you're currently doing. Mixing those two kinds of training together makes you like a flower, as in like or like a rainbow, kind of gives you versatility. Or is it versatility that is the right? I'm looking for the right word. In terms of that, you have more than the average midwife because you've
Mm.
had that
Yes,
international experience.
versatile.
It's just like
Yeah.
experience of someone that works in like all the doctors that go to go and work in the war zone and they come and work in an emergency hospital. They have that experience, quick experience of triaging from that they've learned from there. So they bring in that versatile experience. So I think that's you should kind of emphasize on that a bit more when you're explaining yourself um the what's it called?
Panel.
Panel, yes. Thank you.
Mm.
To the panel, yeah. Okay. So you still want to do some more? I said I was going to do till 7. Then I was going to go and try and eat before this person comes, but she's not here.
Yeah.
Here,
Any last question? Anything? Any advice?
I think my
But the thing is, I have a little concern. Each question you ask me, like I have an idea, but anytime I'm drilled, like my husband asks me some of the question, I tend to give different scenarios for everything. It's like a
because
top of of the time. I can't say the same thing the same. Like I keep changing it, adding some. Sometimes I even remove some from it.
that's
So it has made it
because
the
you've done the work and you don't know how the questions are going to be asked during tomorrow. So
mm,
since you don't know how the question is going to be asked tomorrow, it's always good for you to have a wide range of examples. You were able to
mm,
give me good examples where you some of them at the beginning you was to me I was going to score you two in most of
mm.
those answers that you were giving me because then I had to tell you you needed to expatiate more and more over the course of us working together. You've been able to give me more examples in terms of deeper understanding and in terms of using the star method to answer the questions, and you're using your different scenarios to expatiate on the answers. So what you need to sorry, I was just checking my doorbell was ringing. What you need to emphasize on really is have for each question I said to you, have more than one example. Just in case that if your flow of thinking is not quick, or the way they've asked the question kind of fits more in line with with an answer that you have in mind. So if you have, for example, if you have personalized center care, you've given me a couple of examples as well with regards to that. If you have escalating clinical concern, have two examples of that. So you can choose between one or the other.
Academic small.
So
Okay.
yeah, so I think have more. You just need to continue practicing till tomorrow morning, till you have the exam. Tomorrow, don't force too much. Have breakfast, relax a bit. Don't put too much pressure on yourself. You can talk about it on your way there, but like 30 minutes before then, just clear your head at least. Clear your head and
Mm.
just relax and just think and pray to God. Retentive memory. God should give me retentive memory. God should give me
I'm not,
favor.
when I'm talking, I'm not looking at the ceiling.
Don't look at the ceiling.
I'm thinking, I'm trying to put them together.
I know, but you need to make sure you're keeping eye contact. Don't look at the ceiling, please. Look at them. Like I said, if they're sitting together like this and you don't want to really look at one person, you can look into the middle.
Hmm.
But try and alternate. If you're talking, try and alternate and look there, and kind of move your head if you feel more comfortable. If you don't want to look too much at one person, because most of really there would be writing. They will be writing like this, and they'll be looking up like at you like this, and writing up and all that kind of stuff. So you need to ensure that at least when they do raise up their head, they are catching your eye. They are catching your eye. They're catching your eye, and you're looking at them as they're writing as well. So yeah, it will be fine. You'll be fine. I believe that you've prepared well. There's nothing more you can do that you haven't done. You've prepared. You've practiced and all that. So that's the only thing you can do. You have to practice. You have to prepare. You have to look at your cases as well. Even me, I need to be preparing for my interviews. I have a couple of interviews that I'm preparing for. I need to prepare as well. I have all my questions. I've just been so busy with you guys that
Oh
I've
dear.
not really
I
prepared for my
wish you all
interview.
the best
Yeah,
too.
thank you.
The dressing, I have two dresses. I have a straight dress and I have like a trouser. I don't know what to wear.
What do you feel
I'm,
more comfortable wearing?
all of them is comfortable. I just want something, your appearance and personality also counts. So I'm just torn between. I did a video after the call. Maybe I'll send it to you so you choose for me.
Okay.
Something you as an interviewer, when you see, say, okay, I think she's ready, or something
I
like
think
that.
like me now when I go for interviews, I think I have preferred colors actually when I go for interviews for myself. I have my colors that I like to wear. I like to wear a lot of blue or I wear red. Red.
Oh, okay. This is black. The black with like a blue black jacket,
So that's not
and the
bad.
straight dress is black, white, and the other side is green. I did a video when I was coming.
Okay.
I'll show it to you.
Oh,
Then
that's
you know
fine.
which to do.
Yeah, as in, I think what you feel comfortable with. So many people have their preferences. Like my one of my friends, I think she only wears black for interviews. Anything black. I think she's blacked all from top to bottom.
Let me send it. Then you give the response before you hang up.
But seriously, it's what you feel comfortable in. Like me now, I don't like to wear trousers for interviews. I'm more comfortable in dresses. But that's me. You would not before you find me wearing trousers to work or trousers
I've
somewhere.
sent you
Let me
the
see.
straight dress. Oh God. Wait, you say?
Hold
Oh
on.
yeah. Oh, the fuck.
Um
And this is there. Let me send the.
okay. Let me see. Because it's not letting me open it on my laptop. Some weird reason.
Oh, okay.
Hold on. Yeah, it's nice. I like it. It's very fashionable. I like it. I like a lot of dresses. It's nice. It's a nice
This
dress.
is the tent.
Sorry? Did you send another one? Oh yeah, you did. This is not bad as well. It's a good it's these are good outfits.
So
Wear the
I put the
trousers. Wear the
second one.
trousers and the top
Where the
and the
trousers.
blazer, yeah.
Okay.
Yeah,
All right. And flat black shoe, isn't it?
that's fine.
Accessorize a little bit of watch, not too much perfume, a little bit of makeup. That's what you said.
Yeah.
I'm just quoting it.
But if you're but the thing is that if you're a heavy wearer of makeup, wear the makeup that you would wear on a regular as in your normal makeup.
I'm not everywhere. I become my pimple.
Yeah.
Just a little light one
Yeah, that's fine. Because like
over the back.
one of my colleagues, she's all botoxed up. I think she looks like
Mm.
a Barbie doll. I'm not sure if you know what a Bratz doll is. BR80Z. Go and Google it. That's what she looks like. BR80Z. Bratz.
Be nice. Be
B R
nice.
A T Z. I think that's how to spell the Bratz doll.
Oh
That's
dear.
what she looks like. As in, she is all plasticky. And she is
Hmm.
the head of pharmacy. As in, she's the superintendent something something. She is all plasticky, and that's how she um went for an interview like a plastic safe, and she got the job.
So it doesn't really matter.
It doesn't really
I think
matter.
if they like you, I'm just
Yes,
praying for grace.
that is what I said
Because
to
you can
you.
do well if they don't like you. They won't give you.
That's what I said to you, that grace would speak for you, favor from God. That's what you are. Favor from God, favor from man. I don't know why I
Amen.
like it. Once they just see you, I don't even. There are some interviews that you go for that you don't even need to say much. Even if you are saying all these things you're saying, it's just there's no need. It's
But they
just
will train you on their job. Why are they making us suffer? I haven't been sleeping well for 4 days now. Oh God.
you just need, like I said to you, you just need one. You just need one for one to click and one to happen. You just need one. I'm praying that after we've done this one, the one for the other one that we have to do. Where's the other one?
It's
Leads, yeah. The other one that we will not have to, even if we were gonna go, we're just going just so that we can just go
Amen.
and have choice
Amen.
and have choice
Amen.
in the mighty
Amen.
name of Jesus. So yeah,
I receive it.
in the name of, so just keep on praying. I'm putting
Oh,
you in my prayers as well
thank
in
you.
terms of ensuring that we'll nail this one. We'll nail this one in the name
Amen.
of Jesus.
Amen.
I need to try and go and eat before this person
Thank
comes. I don't
you.
know where she is.
Yes. Oh, are you going to work? Tomorrow is Friday. Are you going to work tomorrow morning?
I'm working from home tomorrow.
Okay, so I won't call you, but in the morning, if only you can just read my message,
Yeah,
I will. I want to practice the Stosia and the theta heart rate again.
yeah,
It's of head and probably send it to you. I'll listen to it myself, but I just want like a different,
yeah.
somebody to say this and that. So maybe tomorrow morning I'll send it to you, and then the last wish me best, and then I'll go.
Don't worry. God has already gone before you. He's gone. God has gone before you to prepare that place for you. So that's what I
Amen.
want
Amen.
you. I want you to just keep at the back of your mind that God has gone there to prepare the place for you. So you will find
Mm.
favor in the name of Jesus.
Amen.
Hmm?
Thank you.
Yeah.
Thank you very much too. You've been very patient with me. I
No,
pray everybody gets to experience you too.
I hope so as well, because I think when people, sometimes you just need that little help. Because I've got it like on
Mm.
TikTok now, people are saying, "Oh, I've gone for interviews, I'm not getting it." They're saying because I don't have international experience. I don't think it's about the international experience. I think it's about the way you answer the questions. If you're not answering the question, even me, when I go for some interviews for myself, I know I've not answered that question properly. I've probably made a mistake. I've kind of waffled. Like my last interview that I went for, I'll always be truthful about stuff. My last interview I went for, because I've recently just come back from maternity leave. My last
Mm.
role, I was on secondment for a year where I was like doing a lot of recruitment, was recruitment focused, a lot of change management focused. So when I went in for that interview, I was given exam, and literally I probably started work this week and I went for an interview next week. So I've not even immersed myself back into work properly. And
Oh
yeah,
yeah.
so I've not really kind of gotten myself back into, and when I even finished my from maternity leave, I think I did maybe 2 months in in my real job before I went for maternity leave. So most of my real proper experience in work was from my previous secondment, where I was doing more change management, recruitment, and all that kind of stuff. And all the
Mm.
examples I was given for a role, for this kind of my role, where I was going to be the head of that team and all that, and the HR business partner for that team, I wasn't given more focus of workforce and all those kind of examples. I was more given more about my recruitment, my change management skills, and what I've done, how I've been able to adapt the way we've done recruitment, how I've done metrics with regards to recruitment. So most of my examples were recruitment based. And when they then came back to me to say,
Uh-huh.
"Oh, Timmy, you didn't answer the questions as someone that is actually doing that role or seeing myself in that space," I understood where they
Mm.
were coming from. So now if I go for any more interviews now, I'm making sure that because I've been back from maternity for a bit now, I'm now more into my role. So my examples are more, I can remember them more. I'm going through this very difficult case now that this woman, oh my goodness, God help me, and all that. So yeah, as in I nearly probably shout, as in I was so angry with her this afternoon with the way she was behaving, but it's part of the role. And I just tried to ensure that I kind of calm myself down and what's it called? Listen and be more empathetic toward what she was going through and see where she's coming from and all that. Yeah. So yeah, in that kind of situation, yeah, you need to ensure that people need to understand that it's about answering the question that you've been asked. Like, at the beginning, I will say to you, move this way. Yes, go and have a snack. I will say to you that, Belinda, that's not what I asked you. This is the question. I had to draw you back into answering the question. Even though you've said something to me, you need to ensure that you're actually saying the right thing. So if you don't, like when you go tomorrow now, if you don't understand, or if it's
Mm,
not clear, you could
mm.
ask them, could you repeat that? Or could you
Oh,
elaborate?
and the questions they ask you, do you have any questions?
Yes.
Um,
Have you written it
from
down?
yeah, the okay. You just mentioned what's it called? Is there anything you want me to elaborate
Yeah.
further? Can I say that as a question?
Yes,
When
you can
I
ask
was
them.
saying
I
to
said to you, as in you can ask
like
them.
throughout the interview, is there anything you think I can elaborate further? I'm happy
Yeah,
to do that. Is that
yeah.
option I can give?
You can say that to them. You can say that
Okay.
to them. Yeah, you can say that to them.
Okay.
But make sure you have those questions written down because I'm sure you would forget in term
Mm,
by the end of the interview.
okay. So I can take a paper and I can get
Yeah,
going
you
by
can.
then.
Yeah,
I
I always have
my
my
own
book. My book that I go
uh,
use for my interviews. I don't even know where is it. It's somewhere. I can I always take a book into my interviews, and also when
I
you
can take this book.
yeah, you can.
I didn't bring any file. It's a bag. Okay, I brought a file. I don't know.
Okay, yeah. Oh yeah.
This file, but do you have to take it into the interview room or
You
just
can take it or you
put?
can take that your book. It doesn't really matter. They're not searching you to see what you brought into them.
Okay, so I'll write it somewhere, then after everything, put a pen there and
Yeah,
then book in.
yeah.
Because I've written some of the interview questions in there. I don't want them to say I was reading from it or
It
something.
just as in I think with tell her I'm coming. Yeah, my person is here. What's it called? If
Okay.
what's it called? If you have a question or if you want to make sure that you don't forget things and all that, write it down to make sure that you don't forget. Yeah.
Okay.
It
Alright.
doesn't it doesn't matter. It
Yeah,
doesn't matter if even if they see that you've what's it called? You have the interview questions in your book. It shows that you have been preparing. They might even laugh at you that, oh, you've been doing a lot of notes. I'm like, yeah, this is my prep, and just kind of skim through your book and look at all my prep for this interview because I really want this job. I'm really excited to work for your trust and all that. Hence the reason why I took my time to prepare for this job. As in, this is my prep, as in I've been for the last since I got the interview invite, I've been preparing. You can just do like this to your book that look, I've been preparing, as in I've been, this is all my preparation, and just laugh about it with them for them to at least feel a bit as in okay, kind of like that sense of I understand you, you understand me, and these are the people that you're,
okay.
yes, breaking the ice. These are the people that you're going to be working with, so they need to be able to be free with you. They need to be able to um understand you and see that personable side to you as well.
Okay.
So yeah.
But I was reading something online. I know there is a lot of things there. It
Yeah,
said that you don't have to look very desperate. If they see that you are desperate, they will give you the job.
there is what is looking desperate, what is looking desperate in terms of speaking to you, you've asked me questions, I'm answering the questions. I think in terms of desperate is that please, please, I really want this job, as in begging them, as in please to make sure I'm the right person. No, you don't need to do all that thing. Let your answers speak for you, which I think you've prepped enough. Let your answers speak for you. Let your knowledge speak for you. Let your personality speak for you, and that is what is going to secure you the job. It's
Okay.
it's not about looking desperate. Don't listen to those people online. There's a lot of information online and a lot of people
Yeah.
chat 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 chat, chat online.
Mm,
Listen to me that I've sat on this side of
mm,
the table.
mm.
Listen to what I say to you in terms of what is desperation.
Okay.
Desperation is I need a job. You and I know
Mm,
what the country is saying. Even the people that are me that I'm on this side as well. Like I said to you, I'm going for interviews as well. I
mm.
need to progress. I need a job that pays me more money. That's the desperation. Okay, maybe I'm desperate. I need more money. I have a growing family and all that. So that's
Yeah.
desperation. But I don't think when I'm sitting at the other side, when I'm the one being interviewed, I'm not looking at it from the sense of, oh, you need to give me the job, please, please, as in, I'm begging. You don't need to do all those dramatics. This is not Africa. It's
Professional.
yes, be professional. When I said to you that even at the end, if you are saying that you want to bring out your questions, and you said they would notice that, oh, am I writing the interview questions? You say, yeah, I'm sorry, as in, this is my interview preparation book. Sorry, I just need to get my question out. And oh, I've been preparing, as in, this is my book for interviews. I use it to prepare, as in, look, since I got the interview, I've been preparing, kind of skim through it, that this is all my preparation, and just put it down. You don't need to show them like that. Just kind of, oh, I've been preparing for it and all that. Okay, I've written down some questions that I have for you, and I'm hoping that you'll be able to answer them. The first question is this, and wait for them to answer. You might even have some questions for them. I've had an interview one time that my questions, I think after when I started asking the question, we were there for an extra 20 minutes in terms of the
Mm,
banter back and forth, back and forth. I got the job in terms of the banter back and forth as to, oh, yeah, okay, I see where you're coming from, but okay, it is how the team works. So what if, then I will have more questions from the first one that I had and all that. What if and what if. So, yeah, it's always good to, and also make sure you're listening to them, to the answers that they're giving for those questions that you've asked.
yes.
Yeah,
Okay.
you'll be
All right.
fine. Yeah, my other
Okay.
client is here. She's downstairs.
Yes, thank you very
Yeah,
much for your time. God richly bless you. I'll speak
amen.
to you tomorrow,
By God's
and
grace.
after the interview, I'll let you know the
Yeah,
questions and
try and make
all.
sure that you save the questions and try and write it down once you finish, so you can give it to me. I want to do a video on your questions because, like my trust, we don't have maternity, and I've been getting a lot of people that have been asking me about maternity. I mean, midwife questions and answers. So if we can do that together, if you can give me the
Okay.
questions, I can kind of research some of the answers and then give it to them.
Okay. I
Mm,
will.
yeah.
Thank you.
Okay, I'll talk to you soon.
All
All
right.
the best.
Bye.
Take care.
Thank
Tell
you.
it to your
You
husband.
too.
Yeah.
You all.
Take care.
Bye.
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 So that was just my client that has an interview tomorrow that I was just kind of prepping. I need to put on the battery. Hold on. I don't want my laptop to die because it's about to die. Oh, everything just keeps falling apart. Just bear with me one moment, people. I don't want it to die because I'm going to lose the live connection. Okay, got it back. Yeah, so that was just my client that was prepping for an interview that she has tomorrow. We've been on it for the past couple of weeks, and she's quite nervous and all that. So yeah, that's kind of the things. That's part of the services I do offer if you do come on to work with me in terms of interview prep and all, and ensuring that you're ready for your interview. So we'll definitely do a lot of questions. This is like her fourth session. which she paid for. So yeah, it's a lot, I know, but yeah, we do talk about everything and making sure that she's nailing those answers to those questions the way I would want to hear them during an interview. Yeah. Just I have another client downstairs. I'm just going to go and see that client quickly. Um and then I'll be back. And while I go, I'm gonna just put down some music for it to be. I don't want it to be too loud. Just a bit of tempo music. Yeah, I just want that to be playing in the background. But I would be back shortly to answer any questions in that you might drop in the chat box. I'll try not to be too long with that client. Does anyone have any questions? Anything you would like to know? just making some thumbnails for my YouTube live that would try and attract more people in. Hello? Hmm? Just calling a client and prospective clients now to see if we can. Hi, hi, good evening. This is HR Ali. Hi, how can I saw your message and based on what what's it called your wife said, I just need to hear from you what your side is. Mm, yeah. Mhm. Also, let me just let you know that I'm on YouTube live, so but they can't hear you. They can only hear my own side of the conversation. So I'm just putting it out there. They no 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 no. They can't even hear you because it's on. I have my earphones in, but they can just hear my side of the conversation. Yeah. So continue. Yeah. Okay. Um. First things first. With regards to the private sector, the private sectors are quite skeptical about what they don't know. If they don't understand it, they tend to be quite skeptical about it. And so what you're saying is that you've been a registered nurse in Nigeria for 4 years. You moved to the UK 2 years ago. Okay, 2 years ago. Sorry, hold on. What do you need? Go and call your sisters for me. They need to come and take me to bed. Why did you close the door? Sorry about this. Yeah. So 2 years ago. So do you currently have sponsorship or you don't have sponsorship? Do you need sponsorship? Don't need sponsorship. Okay. Which is a bonus. Okay. Um when does your visa expire? Okay. 27. So about 2 years. You still have about 2 years on it. That's fine. Okay. So let me just get a clear picture about you. Registered nurse in Nigeria, moved to the UK 2 years ago. You have you don't need visa sponsorship. You have a visa that expires in 2 years' time. When you moved to the UK, you've worked as a healthcare support worker in the NHS. Is that through agency? And you got into as a NHS support worker. Okay, interesting. As what band is that? Band two? Okay. Yeah, directly. That's fine. Okay, so you're currently band two in the NHS as a healthcare support worker. What trust is that? I don't know. Okay. That's a beautiful place. It's fine. So that's a beautiful area to live. I'm jealous. That's a beautiful area to live. So okay, okay, okay. What's going on? Okay, that's fine. Okay. I'm just trying to get a clear picture of you. So you're trying to apply. You've now gotten your pin. Do you have your pin? You have your pin. Have pins. I'm trying to understand why you're not a sought after person. You have your pin. You've been applying to private sectors. You've not been able to get a job. NHS, you've been getting, unfortunately, in terms of your applications. Have you gotten any interview as a band five? Okay, one interview. Okay. Mm, mm, mm. What you said you didn't do work on. Okay. Okay. Yeah. Yeah. Mm. No. Okay. No, okay. Yeah. Okay. Okay. Mm-hmm. Mm-hmm. So do you? Sorry, I need to take off this thing off my ears because it's kind of hot. You don't mind me putting it on speaker? Okay. But it's hot in my ears. Okay, I'm listening.
So, with the managers I've seen so far, to
Yeah.
have an informal chat with, so they showed me around their work environment, and then I asked them a couple of questions just to know if it's actually a bad idea to apply for this role as someone that doesn't have a UK experience as a registered nurse.
Mm-hmm.
And yeah, two of them actually said no, it's not a bad idea. It's a welcoming idea for any applicants.
Mm-hmm.
But some of these vacancies that I've applied so far
Yeah.
are actually restricted. They have kind of restriction on their applications, like saying it's for internal applicants.
Okay.
So when I discussed that with a friend who was in NHS, so what he said is that was that because of the fact that they are relieving some nurses or probably they are closing some wards, they would not want to just let go of some of their staff. So instead of letting go of their staff, they would rather employ them in another ward or another department.
That's
So
true.
that's why they are making it the internal applicants so far.
That's true. Because like if the person did say that person is correct. For those kind of roles, you wouldn't even be able to apply because they would ask you where do you work and stuff like that, and if you tell them you don't work in their trust, immediately you get rejected automatically. Because recruitment has to be open and fair, they would need to ensure that that advert is advertised, and because it's on track, everyone can see it. And once they put in that parameters of just internal applicants, if you try and apply as an external person, you will automatically get rejected. So looking at or hearing your profile in terms of being a registered nurse, for having your PIN in the UK, being a healthcare support worker, band 2 in the NHS, applied to a couple of places, you've done some interviews, you don't need sponsorship, and where you live. I think you're a very good candidate. I'm trying to understand why you haven't yet got to secure the role. It might be, firstly, your application form. How does it look in terms of the structure of how we've done it? But I think it shouldn't be too bad if you've been able to secure at least two interviews based on that structure that you have in place. So we can look at that together. What are you writing in your supporting statement? What are you writing in your supporting information? How you write your supporting information matters a lot. So we might need to look at that together in terms of, is it saying the right thing? Because I shortlist. I shortlist applicants. I sit on an interview panel, so I know what I'm looking for when I look at an application form. There is a certain way I like to see applications, um, information or application forms, that if you don't do it that way, it just makes me, oh, I have to read properly and all that, and I have to start looking for the information on there. So there's some certain ways that I would like to say it, but it's not everybody that does it that way. But you need to ensure that you're putting in the right things. When each of those points that they put in the application form, I think for person specification, that is where we pick out the that is where we mark properly your supporting information from the person specification. And I think that's what a lot of people don't understand. You need to answer all those boxes in the person specification and answer them correctly, sticking to your 1,500 words if you are using track, and sticking to the word count if you are using NHS jobs. So, how are you answering your questions in the person specification for your supporting statement? Are you answering it properly? Are you just zigzagging and just saying whatever you like? You're not tailoring it to each of the jobs. That is what might not be letting you get shortlisted for roles. Then, if you do get shortlisted, how are you answering your questions in the interview? Are you answering it properly? Are you answering the question that was asked? If they ask you A, you're not saying C. Or if they ask you capital A, you're not saying lowercase a. So those are the kind of things that you need to ensure that you're bearing in mind when you're doing your application. I do offer one-to-one coaching services from looking at your application, from looking at your application to writing supporting statement to interview preparation as well. So I've been successful with at least, I have about maybe four clients that have been able to get jobs. And the fact that they are telling you that if you don't have UK experience, you can't get a job. Well, you have UK experience as a healthcare support worker. You've been doing
Yeah.
that role for how many months now? For the
Over
private,
a year.
sorry?
Actually, over a year.
Over a year. So that's more than enough. So even in your trust, are you seeing any roles that you can apply for in your trust as a band
Yes,
five?
actually.
So
Yes,
that is
actually.
that is the easiest place for you to be able to go. I don't feel you should go anywhere else but that trust. If you
Yeah.
see any
Most of
role
the
in that trust, what I would suggest for you to do is go to the recruiting manager. Go and look for the recruiting manager, even if you're not meant to be on shift on that day, or even if you're on shift, you can go during your break if you have time to go for break, because the NHS they overwork us there. Go to that manager and say, I want to have a discussion with you. I want to have a talk with you. I've seen you advertise this role. I'm currently work in the trust. I want to move. I have my pen. Those are ways for you to network. It's not just networking for that it happens in Nigeria and all that, or networking happens everywhere. That's how you get roles. That's how you get yourself known to people that you're interested in something.
I have actually made some moves regarding that. So, firstly, you talk about getting the job within the trust.
Yeah.
So, the trust I'm working with is majorly, majorly, they have more of mental health
Okay.
facilities, and I mean, adults registered, adult registered nurse.
RGN.
Yes.
Okay.
So most of the facility they must have mental health nurses. My manager as a person would have even employed me according to what she said. So, but because of the fact that they can't employ RTN on the wall, they only employ RMN.
RMN.
Yes. So that's that about my manager. And then we talk about that's not about working within the trust. Like there are a couple of rules that in line with RTN rule which I've applied for. And then apart from the fact that I got response from few of them telling me we won't be able to carry on with your application or something similar like that.
Yeah.
So I actually got an email from a friend at work, like I think it's for the recruiting department, like it meant
Team.
team, yes. So I tried to mail because I don't know the manager in person. I'm not even sure is he or she is working within my facility, within the facility I'm working at. So I tried to mail the person, and I just called. I sold myself out to let the person see the reason why I want to work. We still work in the trust, my skills, my experience from home, and things like that. So the response I got from the resource manager was to go to the link to see the vacancies of from roles which I could apply for. So it was just like telling me to apply for the vacancies online.
Which is correct, because with the trust we do blind applications. They wouldn't see who has applied for the roles until the person has been shortlisted. So
Yeah, but these are the same roles I've already applied for. I was just trying to make a kind of develop a kind of rapport between
yeah, you
myself
can't.
and the
There's nothing
individual.
they can do with regards to that. They will tell you to go online. They will tell you to go online and apply, and they would only shortlist that person, or they will only shortlist you if you fit into the scoring criteria. So, for example, now 10 people that have applied. Now I don't know these 10 people that have applied. I'll shortlist. Okay, I'll say, okay, I want these 5 people to be coming for the interview. I wouldn't know the 5 people that I've picked until I get to tell recruitment to say, okay, invite these 5 people, and then it will now populate the names of the 5 people that I've shortlisted. That is when I would know who are actually shortlisted. So you going to tell them and say about telling them about you and all that. There's no way they would know your application from from the next person. That's what I'm trying to explain to you, that you need to ensure that you are doing a very strong application. In as much as you've gone to speak to them, your application still needs to be strong, and you still need to stand out enough for them to shortlist you, because it is a merit based shortlisting. It is not by who you know or you speaking
Oh yeah, of course.
to someone. So that's what I'm trying to say to you, that I do offer services that can help you to ensure that you get shortlisted, in terms
Okay.
of how you write your supporting statement, um and how your, what's it called, your application looks and all that. So I do offer that service, and I also offer the services of interview preparation as well. In terms of, we will do 2 hours session of interview preparation, where I would coach you, and we will go through real life scenario questions of what to expect during a real life band 5 role for an RGN nurse, from my years of experience of sitting on the other side.
Oh,
I normally do at least in a month, I can be on the interview panel sometimes 3 times in a month, sometimes two. This month so far, I've been on one, and my recruiting person has already told me that she might need me to be on another one next week, which I'm trying to get out of, because when I do interviews, it's the whole day, and that means my work. I'll have to do my work when I get home, so that's double work for me on that day. So mostly I try to do a maximum of two, like a minimum of one a month. So I,
okay.
to kind of keep my kind of momentum in terms of interviewing and shortlisting. I don't like doing shortlisting because it takes, that one is even the worst one. Uh, so um, so with shortlisting, I try to do as minimal as possible and just help them with the interviewing. So like in a month, I might not do any in a month. Truthfully, I might not do any in a month. Maybe in 3 months, I might do one or two for shortlisting at this point now. So
Mm,
yeah. So I know what I want to hear from interview. I know what I want to see in an application as well, and I know what we're looking for. If I apply for a job for you, and by the time I finish writing that application, even you guys said you believe I'm the best thing out of slice of bread. So as a, if I apply for a job, and with NHS, I kind of understand the tips and tricks, because I do it on a constant basis in terms of shortlisting and all that. So I know how to structure answers or structure responses for the person specification and the supporting information aspect of things. So it's something that I do. I currently work in the NHS as well. Um, I have over 10 years experience in NHS, over 20 years experience working in HR. So this is my bread and butter. This is what I do regularly on a day-to-day basis. So it's it's my livelihood as well. So that's what I do. So if it's something that you want me to help you with, to try and structure your applications, try and
well,
structure.
yes,
Sorry.
of course. Yes, of course, yes.
Yes. So I do charge for my services. I do charge for my services, and um what's it called? Depending on what, if you're happy to pay, then we can start working together. But I would still need to check in terms of, I need to check my calendar as well. In as much as you want to work with me, I need to check what level of work do you need me to work with you. Is it just going to be like a one-off thing, or is it going to be like a proper deep dive from start to finish? With that start to finish, I'm thinking that I think I want to put a cap on the number of people that I'm going to work with on that one, because that takes a lot of my time. So at the moment,
Okay.
I have two people that I'm working with on the deep dive complete application process. And I think I'm going to do a maximum of four out a go. So I still
Okay.
have two. I currently have two, and I still have two spaces left. And I know I was speaking to someone yesterday. She was meant to come back to me today. I'll probably email her to ask her what she wants to do. So
Right.
I still have two more spaces left. It's not like I don't have. I still have two more spaces left. So I'm only doing four people maximum for the deep dive full package. But other packages, I think I still have capacity to kind of I still have capacity to, excuse me,
All right.
to take more clients on. So depending on what you want in that sense.
Okay.
Yeah.
So if you don't mind, can you let me know how you charge and
Okay. So
time again because it's what I really, really want to get out of my way. And then,
Yeah.
so,
I really do. I'm quite invested in people that I work with. I'm quite invested. I do look at you as not just a client, but someone that I'm helping to secure their future as well. So to me, it's I've been doing this for years, helping people without charging. Then I realized that I need money, so I decided to start charging people. Um, yeah, that's the honest truth about this. I used to help. Some of my friends still send people to me, and I've been telling them, look, I'm now charging, and you need to know when you're sending your friends to me or you're telling people about me that I charge people for this. My mom will call me and tell me that this person's son's brother's child is looking for a job. Give her a job. That kind of thing. So they think I see why I I um I have this recruitment agency that I employ people there. So yeah. So if it's something that you're interested in, let me know. Um I do have success rates. I do in terms of know what I'm talking about and know what they're looking people are looking for, especially the interviewers and the recruiting managers. I know what they're looking for. So if you want success to to um to what's it called to get in that next role, definitely work with me and we would definitely smash it. Also, I have a YouTube channel as well. You can go on my YouTube. Is your HR ally? Go on my YouTube channel.
HR,
Ally. Uh,
sorry, can you spell
I
that?
would send you an email with it. I'll probably send you the link to my channel actually. I'll send you a link
Alright.
to my channel. So go and check my videos on there. You see what I look like actually on there. So you see my face. I do show my face on my channel and also on even TikTok. I show my face there as well. So I'm not a robot. I'm a person that works in the NHS. I love working in the NHS. I think it's a fantastic place to work. And once you get in, once I think for people, once you get in, is getting in. You're already in, and I'm really surprised that you're really still struggling to get to do that transition from band two to band five. Once you get in, it should be much easier for you to transition around and move around a lot more better and move along around a lot more better. So yes, please, yeah, is it please or yeah, I would really like to work with you. Truthfully, I would really like to work with you. For me, it's not really about the money. I do say all this maximum, 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 and my husband has been telling me that um I need to be what's it called? Be more strict. That this is a business, and I'm still treating it as if I'm helping my friends and all that. That this is now a business. I need to change my perception about how I set parameters for my clients in terms of messaging me and calling me and me doing more than they've actually paid for and all that. But I do see I do see my clients as more than just a number for me. I'm quite invested. Like my lady tomorrow, I'm so invested in her as in I really want her to get the job. I'm praying for her hard. I really, really want. She's suffered enough in terms of the amount of rejection. So you can imagine applying to more than 90 jobs and just getting, unfortunately, you've not even smelt even what's it called. I remember when we started working together. I think she did one application. Actually, three applications. She was actually. I did more than two for actually. Come to think about it, truthfully. I did more than two applications for her, and one of them, she actually got a call. As maybe submitted this night, the next day she got a call. But the reason why she wasn't, they didn't specify really on the application. The reason why she wasn't moved on because she had like a preliminary call for the trust. The reason why she wasn't put through to the proper sit down interview was because she doesn't drive, which was one of the reasons which was one of the main criteria for them, but for some reason they didn't put it on the application. So that was like the fastest um response she's ever got. She was like, "Oh my God, sis, they called me, as in I am shaking and blah 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 that they're going to call me back at so 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 and so time. What should I say? What should I do? And all that kind of thing." She paid for the full package and all, and I've been very invested in her in terms of it's not just the money. The money is good for me, yes, of course, but my joy is seeing her get that role. Apart from the other ones, I do tell her that my other clients, I'm sure they will be like, "You're not like this with us," and all that. Well, I don't know why I've just taken a likeness to this person, to this lady, and I just love her spirit. I just love her. So I'm so 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 invested in ensuring that she gets the job, and we're working really hard in terms of the interview prep and all that. Anyways, I'm talking too much. I'm not trying to sell. I'm trying to sell my services, yes, but also I'm just trying to let you know the kind of person I am in how much I do cherish people that do come to me and get try to use or use my services, or me helping them to try and get into that next step of their life, because it's the next step for people, and making sure that they are sorted out, because it's it's a lot of things that it affects. I'm not just going to help you get a job. You have financial security for yourself, and if you're married, for your wife, and if you have kids, for your kids as well. I'm busy. He's on his way back home. I'm gonna check him downstairs. Yeah. So sorry about that. So I think it is a chain, is a circle, and is a chain for not just you, then your wife, then your children, then your family, then them as well. It's a continuous thing. So me helping one person helps a lot of people as well. So I think that's how I see it. So if you're interested in using my services, let me know quickly, because by me going on all these lives, I'm getting a lot of calls, a lot of people wanting to use my services, and based on you, I think you're a very good candidate for me to help. And there's some people that I know I can never help, and I'm very upfront with them. You can pay me, we can try, but if I feel I'm unable to help you, I would let you know that I'm sorry. You can pay it, but chances of you being able to secure a role, it's very slim. Like someone that doesn't have visa, you're here on a visa, you would need a lot of stuff. You don't have the right qualifications. We're gonna then have to start letting you go to study and all that kind of thing. You can't just come up and say, "Oh, I want to get a job in the NHS," and you don't have any healthcare related job. That's if you're going for the health side. But if you're going for an admin one, yeah, we can work together to try and get you there. But if you don't have the right visas to even be in the country in the first place, I'm not even going to even bother starting. It's a non-starter for me. I'm like, I'm sorry, I can help you. You have to have the right to work currently in the country before we can then start. So yeah, let me know if you want me to help you, and you have my email address.
Yes.
I would only give people my telephone number once we start working together, because at the beginning I was just calling people directly and all that, but now I've just decided I don't want everybody to have my number without us having like a business relationship together first.
Sorry.
Okay,
Thank you
no
so
worries,
much.
Olayemi.
Yes. I'll get back to you via your email.
Okay.
Thank you so much for your
No
time.
worries. Have a good evening. Thanks for stopping, and thank you for letting me talk your ears off.
Okay, thank you. Anytime.
Take care. Have a good night. And thank
Thank
your
you
wife
very
for me
much.
as well for
All
reaching
right.
out.
All right. Thank you so much,
Have a good
Harry.
night.
You too.
Take care. Bye.
Bye.
I think I ramble quite a bit. My husband keeps saying I ramble a lot. Yeah, I do ramble. I need to stop. I need to stop rambling. I need to stop rambling. Mm, um, Yeah, I'm just trying to give my new prospective clients the details to my YouTube channel. Just tell them to subscribe, like, and watch the videos. Thanks. Yeah, yeah. Okay. Am I subscribe? I can't subscribe to myself. I can't subscribe to myself because it's asking me to subscribe. I'm like, I can't subscribe to myself. Um, One day, I think I replied to you. I think I already replied to this person. Mm, yeah. How is everybody doing? Am I still on mute? How is everybody doing? That was just a quick conversation. Wasn't really quick. It was about nearly an hour conversation with a prospective client. I'm hoping it does come on board. It seems genuinely like a really nice person that I would be able to help because it's just quite sad the fact that he's been unable to kind of break that entry into the NHS. I really do feel for him. Yeah, I really do feel for him. I really do feel for him. Yeah. Mm. Yeah. Yeah. So if anybody else or no one is really engaging with this stream tonight. I don't know what's going on. Did I come on at the wrong time? I did leave for a bit. I'm really sorry about that. I was really hungry. I hadn't eaten all day. Um, what's it called? I know I'm not getting those. I don't know what else to do really. Um maybe I don't know, maybe I should need to do more. I don't know really. Is there something I need to do that I'm not doing with regards to my life? Or am I not look at me. This is a representation of me. Where is this picture? I need to find this picture. This is an avatar picture of me that I did. It's so pretty. It's so pretty. Why is this thing not 747? What is this thing saying? So what happens to the 300 hours that is there like a YouTube um is it like a YouTube custom? 'Cause I don't understand. some things I see on my phone and some things I see on YouTube homepage is so different. Mm. I don't know. I need to go into my studio actually and find Hello. Hi, hi, hi. Welcome. Welcome, welcome, welcome. Type your comments in the comment section. Let's see. Where is it move up there? I might need to move.